Good afternoon, Port St. Lucie. It's your mayor, Greg Oravec. And this afternoon, we are, of course, joined on my right by Russ Blackburn, our city manager, and in times of emergency, our incident commander. And as you may recall, this afternoon, we were going to be joined by Congressman Brian Mast, but he was called to D.C., he's called to Congress, and that's a great thing because it means that the legislature, our federal legislature, and administration are making progress on that PPP. If you remember, the payroll protection program and the paycheck protection program. So it's great that they're making progress, and hopefully we'll get a deal soon. So we went to another great Brian to have, Brian Bauer of our Career Source Research Coast. And it's a pleasure to have you both here. Thank you for joining us, Brian.
Thank you, Mayor.
And Russ, thank you so much. Russ, I'll turn it right over to you for the update on the city's response and budding recovery effort for COVID-19.
Yes, Mr. Mayor, thank you. And we want to thank everyone in our community for really obeying and following the state Better Off at Home rules, the CDC guidelines. It's really helping. We're seeing the number of cases in our community stabilize as well as the hospitalizations. And that's really a direct result of following those CDC guidelines. As your city, we've done everything we can to make sure that our services continue to be delivered at a high level. We have changed the way we deliver some services. Previously, you could come into City Hall and access services at one of our customer service counters or get a building permit at the counter in the building department. We've changed the way we do business to lessen those personal contacts, but we haven't lessened our customer service. And actually, we think we've actually increased some of our service. In our utility department, we've actually reduced the time it takes to get service from our utility department, the time that you're waiting online to talk to someone in person. And we'll probably continue those improvements for the long term. So we've learned a lot from our COVID-19 experience. But you can still count on clean water. You can count that when you flush the toilet, your waste will be cleaned effectively, and that you'll be able to live in a community that you're proud of from an environmental standpoint. So the city has begun to, while we're still focused on the compliance with the CDC guidelines, we've begun to think about our recovery. We have teams of employees that are working together to think about what's the city look like after this event. How can we help to jumpstart, do our part to jumpstart the economy? We're looking at waiving or reducing some of our fees where appropriate. The city council recently made a decision to enter into a purchase and sale agreement with Project Excel, which is a coated wire manufacturer, to actually bring new and better jobs to Port St. Lucie. And later this week, we'll be considering a letter of intent with a large industrial development speculative builder, which would also result in jobs for our community. So certainly we know that everybody is looking very short term right now. How do we react, and how do we put COVID-19 behind us? But longer term, we're looking at how do we make Port St. Lucie an even better place for everybody who lives here.
Thank you, Mr. Blackburn. Thank you, and thank our staff for the continuing hard work. You know, here on April the 20th, 2020, we're just about 1 month in to our COVID response and the date of our very first case, which I believe was on March 21st. And as we sit here this afternoon and evening, the current numbers, COVID-19 has infected more than 766,000 Americans, 26,660 Floridians, and 204 residents of St. Lucie County. killing 40,931 of our fellow Americans, 789 Floridians, and 15 right here in St. Lucie County. And I would just like to extend our deepest condolences to the families and loved ones, the friends, neighbors, everyone who's hurting and who's mourning the loss of their loved ones. The loss of American lives is the most terrible price we can pay in this battle against the novel disease. And unfortunately, it's not the only one. This is a public health crisis, and it is also very much an economic crisis. We have historic levels of jobless claims and people applying for unemployment, or as we call it in Florida, reemployment. We have a lot of people who need work, and they need help, and they need assistance. And so this is a huge part of the response. In addition to the public health response, we also have to respond on the assistance side, on the economy side, and it's such a privilege, and of course it's always a pleasure, even under difficult circumstances, Brian, to have you here. You are one of those foundational community partners at CareerSource. We work together, we collaborate all the time, but a lot of times you don't come out and you don't attend necessarily a council meeting, or you're not on the TV with us normally. So as part of your addressing the community today, could you just remind us of what CareerSource does? Sure. And then turn to the specifics of the response?
Sure, be happy to, Mayor. Again, thank you for having me today. Maybe I need to do a little bit better job getting to some of the council meetings so I show my face a little bit more. But CareerSource Research Coast is part of the CareerSource Florida Network, made up of 24 local workforce development boards throughout the state. Our particular board covers Martin County, St. Lucie County, and Indian River County. So we are the employment training arm, so to speak, of jobs and economic development. So economic development and workforce kind of go hand in hand. We treat our customers, and our customers are our employers. And the product that we offer our customers, which are our employers, are our job seekers. That's our product. So we want to make sure that we provide the skilled, qualified, talented pipeline that our employers are in need of. We focus on sectors, but that doesn't mean that we won't help any individual that's looking to better themselves. But I mean, our sectors of focus right now currently are the advanced manufacturing, and within the advanced manufacturing, you're looking at marine, you're looking at aerospace. We have healthcare, of course, skilled trades, distribution and logistics, hospitality, and professional and business services are our main sectors of focus right now, to where we can provide assistance. And when I say assistance, I'm talking about we do have the opportunity through federal funding grants that we receive to provide training assistance to both employers as well as job seekers. I'll first go into the employer side. Locally here, our toolbox is an on-the-job training, or we call it OJT, to where we can provide assistance in the form of a subsidized cost reimbursement to an employer who's willing to take a chance or a risk on an employee who might not quite have all the skills they need, but they're close. So they have the opportunity through a contract with us, to a short-term training contract, and we would reimburse that employer for up to 50% of the training costs of that employee for a certain period of time under that contract. Another component that we're focused on, the state's focused on, the nation's focused on, is apprenticeship. We very strongly believe that the best way for individuals to learn is while they're earning. So in that model is apprenticeship. So we have really focused here in the Research Coast, Treasure Coast, in our 3 counties, apprenticeships. We do have the ability, and we're actually a sponsor for several apprenticeships right now. When I say we, CareerSource Research Coast is a sponsor for a manufacturing apprenticeship, a logistics apprenticeship, and we're working on several others. So, and now I mentioned individuals. So what can we offer an individual or a job seeker coming in? Well, you might be in a position or opportunity that's not quite where you want to be. You want to better yourself. We call that career pathways. We might be able to provide, based on eligibility and suitability requirements, offer you some training assistance to go back to school, get a certification, or better yourself on a career path. So those are some of the tools we have locally here. that are incentivized tools to both our job seekers, our community residents, and our employers in our communities. We also have a lot of free services, such as you can come into any one of our centers for job search, workshops, resume assistance, you name it. We have the ability to do that. At this time, of course, with the COVID-19 and the pandemic, we, like most of our other entities, are closed to the public physically, but that doesn't mean we're not offering services. We are running full 100% virtually right now to include virtual online workshops. And I think that is a great opportunity for those that unfortunately have lost their job. And I'll get to that shortly, some statistics on that. But to be proactive at this time when you're at home and you're sitting around doing some, what am I doing, watching TV? Well, consider going to one of our virtual workshops to brush up on your resume, get your resume skills, get your resume polished, interviewing techniques, job search skills. These types of workshops that are available to you that you can go online. We have an online chat feature that we've just implemented on our website, so you will get to speak with somebody instantaneously. There will be no voicemail, or hopefully you get through. You'll get somebody, and either we'll be able to help you right there, or we'll have somebody contact you back for assistance. So please take advantage of those opportunities that are available to you. Check out our website, careersourcerc.com, and check out the COVID-19 page or our homepage.
Brian, thank you. And would it be fair to say that CareerSource is a workforce development type board, and that you connect employers with employees, that you connect the employers and the job creators with the workforce?
Yes.
And that you help the citizens out there who might be looking to upgrade, who might be out of work and need to retool, if you will, or acquire new skills, that you help connect them to the opportunities that are there now and that you perceive as being there in the future and the days ahead?
Yes. Part of our strategic plan and our local four-year plan, which we're required to submit to the state every year, talks about those very same things. What do we see now as sectors of focus, or positions, or industry clusters now, and what we foresee in the next 2, 4, 5 years as far as where should we start focusing our talent pipelines. We work hand in hand with our educational partners, such as Indian River State College, Kaiser University, our K-12 system here in St. Lucie County, which, by the way, wonderful system, to start building those pipelines. We're understanding that we need, well before COVID, we were struggling with where's the talent coming from. So we were starting to build those relationships with our schools so that we can start talking to our young adults about opportunities outside of college, so to speak. So there's short-term training opportunities that can get you into a work right out of high school. That, again, I go back to that earn while you learn mentality, and then maybe college down the road, or additional certifications or credentials to build your career pathway. But yes, that's our main charge with regards to our job seekers and our residents in our communities.
Well, and thank you. And, before I was just talking about that maybe some members of the city hadn't seen you, but we want you out in the community and with employers, helping to facilitate the creation of jobs and connecting people. So especially over a multi-county area, if you went to every government meeting, you would have no time for the real work of your organization. So don't go there. Keep doing what you're doing, and we'll just bring you in for shows and make sure that the people know what a great service you're providing out there. That being said, do you feel your seat getting hot at all right now?
Yes, we're
Well, good, because that was just really a yes or no, because here it comes. So you're not DEO, and by DEO I mean the Department of Economic Opportunity, which is the agency at the state that's responsible for what we call in Florida as reemployment. And actually, I mean, in fairness, the governor has now said, in addition to DEO, I'm bringing in this other secretary to run this because it's that important. It's not operating how we want. But you are kind of DEO adjacent. And I think it's fair to say that this is an all hands on deck situation, and you and your brothers and sisters in the CareerSource and the workforce development boards have been called to the field. Is that true?
That is correct.
And where are you at, and what kind of advice and what kind of news from the front lines, or maybe from behind the scenes, what can you share with the members of the public so that they know what's going on with reemployment?
Well, it has been trying times for the department itself. You're seeing extraordinary amounts of reemployment claims trying to be filed. The system is the system, technology is technology, and it's not just Florida, it's the whole nation that's struggling with unemployment. But I'll get into some data here shortly about our figures here as a state, and then maybe some local numbers as well. But yeah, we were, as a part of one of the executive orders, tasked as the CareerSource Florida Network to all hands on deck to help out with providing assistance to our folks that have lost their jobs as no fault of their own. That being in the form of, at the time, it was providing paper applications for folks to submit. And then as recently as, like I mentioned, virtual services, they now have a web or a mobile-friendly application that folks can apply for their unemployment benefits as well. So we also have staff tasked locally to do some functions at the DEO level, such as a PIN reset. That just came down. We just completed our training for our few. We have 7 staff that are on board here throughout the 3 counties that can assist those that are able to get in to connect to have a PIN reset. We can do some of those things. We can review the claim, see where the status is, see what might be going on with the claim or what the holdup might be. But again, you also have to understand our staff also need to get in and connect. So if Connect's not working for a claimant, chances are that the Connect system's not working for our folks. And that's where the frustration is coming in for everybody. We understand that it's hard for you all. There's a lot of stress, a lot of unknown going on for folks that lost their jobs. But in the same token, very limited in what we can do. We're here to help you in whatever way we can. And we do have constant weekly calls with the department. We are provided updates with the department, and I know the governor has put all hands on deck. He has eliminated or waived pretty much every requirement that used to be required when you filed a claim, to the point where all that's left with filing a claim is if you submit an application, it's just waiting for that return call to have that application processed, approved, verified, then uploaded into the system. So that's about where you're at now. There's no more employer registration. The 2-week claim where you have to claim your weeks, that's been waived. What's the third one? Work search requirements has been waived for this time being right now. And that, I believe, was May 2nd, and don't quote me, but I almost want to say it's been extended to indefinitely till we can get the system where it needs to be so folks are getting paid. Because as you all know, that it's not just your state claim, it's your federal claim too. The federal stimulus is tied to a state claim. So we want to make sure that we get as many folks in as quickly as possible so that they can get started claiming their weeks both at the state level and the federal level.
Well, I really appreciate you touching on that. Even though you're just DEO adjacent, you're not DEO, but it's very important, obviously, and it's not a matter of if we're trying. We need to get money into the hands of the people who are out of work and hurting. They need those resources. So that's you being adjacent to it, but something that you're really on top of and really is in your wheelhouse. This is your purview. This is what you do. There are jobs out there. So we are very focused on the job losses, and rightly so. But there is, there's a little bit of good news on the job creation side that people are hiring. Could you run us through some of the opportunities?
Sure. I don't know if anybody's had the chance to look at, we provide an employment report monthly that provides our local statistics of unemployment rates as well as area industry sectors with the most job gains. And believe it or not, the March report that came out showed 1,600 jobs increased over the year in professional and business services. So somebody might say, well, where are those industries or what are those? Well, a lot of that is in the customer service realm for call centers, so to speak. So a lot of people, as we know, are working virtually. So they've had to ramp up their call centers so that you can have more people take that volume of calls. So for example, your Comcasts, your Comcast, Lowe's, Home Depot, Premier Lab Supplies, Publix. We also have skilled trades has been relatively not unaffected by this. So you still are seeing growth. Homes are still being built. So you have the Treasure Coast Builders Association still looking to hire or help their membership find talent in their sector. Healthcare, of course, healthcare, we all need those frontline, and I want to say thank you to everybody that works in the healthcare industry right now. I have to say, without you, it would be pretty crazy right now. So again, thank you to each and every one of you for what you've done to date, and it does not go unnoticed. HCA Healthcare, Champion Healthcare, Premier Lab Supplies are just a few of the companies that are looking to hire. If you want to get a full list of these, please, again, go to our website at the COVID-19 portal. We have a listing of companies that are currently hiring, as well as our state system, Employ Florida. Please feel free to go in, register, and do a job search with regards to those companies as well. Oh, and by the way, I didn't forget, City of Port St. Lucie is one of those places that are looking to hire folks. So you were on our list as well. So thank you for having those positions available to our residents.
Thank you, Brian. And what's the website again?
Our main website is careersourcerc.com. And then we also have the landing page for the COVID-19, which has all the information you can imagine related to COVID, either whether you're an employer or a job seeker. So again, that's COVID-19 for the landing page. And you have an instant chat, so if you have any problems or you can't find anything, please click on that little instant chat that's down in the bottom right-hand corner, and somebody will guide you where you need to be or provide assistance. I did want to, if I could, Mayor, I did want to throw out some numbers with regards to the reemployment. We were able just today or this weekend receive some statewide figures as of 4/19. So from 3/15 to 4/19 statewide, there were a total of 1.5 million claims submitted for reemployment assistance. Now, these claims are those that could have been a Connect, or could have been a paper application, or could have been done through the mobile-friendly app. So some of those numbers might be skewed because we might have duplicate applications somewhere in that pipeline. Claim verification for the state is approximately 650,000, which 99.6% of those are unique claims that were submitted. Claims processed, 162,000. So you can see where the state is struggling a little bit with regards to processing those claims.
And how many people are actually unemployed in the state now based on the best available information?
I probably would say 1.5 or higher, an
Right.
estimated 1.5.
And so that 600 and change number, that's how many that have successfully got their application in?
Has been verified.
Verified.
Verified. Processed is 162,000.
Right, so we know that feels really low.
Yeah, that's
But
about
even that
25%.
600 number, I mean, how many
About half.
people are trying?
Right. 1.5 million applications have been submitted, so.
Wow,
So
so,
you're seeing the bottleneck. there is a bottleneck there. They're addressing it, but we do have a bottleneck. And the last one is, and this is the one that's the hard pill to swallow, is claimants paid, there's only 41,000.
so it hasn't happened in a real way. So we have to understand the frustration of the people, and, I know there's only so much you can do, and hopefully we're going to see that improve every day, and that's why we hear it at every one of the governor's press conferences. Mr. Manager, you have any questions for Brian?
Well, not specifically for Brian, Mr. Mayor, but Brian, along with the EDC, the St. Lucie County, the City of Port St. Lucie, have all joined together in a virtual small business assistance center that will be helping people in our community that have small businesses try to get back on their feet. So the best way to have our unemployment addressed is to get businesses back open. And so the EDC is spearheading that along with the SBDC. They'll be located, at least in the Port St. Lucie area, they'll be located at the Prudent campus of Indian River State College. And we'll all be working together to try to help businesses get their footing. And that's really critical as we go back. And I don't know if, Brian, you want to talk a little bit about that effort?
Sure. Thanks, Russ. I'm glad you mentioned that because I think that you were hit the nail on the head, and I want to commend Pete Tesh, Executive Director of the St. Lucie County EDC, for spearheading a lot of the projects that they have already put forth with regards to the employer side of things. And another one that was a wonderful collaboration that was in partnership with the EDC, the Chamber of St. Lucie County, our local tourism folks, and CareerSource was what we called 500 businesses in 5 days. It was a business outreach effort that was done a couple weeks back. As this started to really hit home to our employers, we wanted to just call them, reach out to them, say, how are things going? We're here for you as best we can be. What do you need? So we were able to get, I think, almost 400 call-ins. We didn't quite make the 500, but 400 is pretty good in 5 days. So I have to commend everybody that participated in that, all the partners that participated in that event. And some of the feedback is the employers really appreciate us just reaching out to them to say, hey, thanks, I didn't know you guys were there. Glad to hear you're there, and and here to help us in whatever way we can. But the Disaster Recovery Center that you mentioned, that will be hopefully open once we can get back into the workforce realm. Right now, we're looking at a plan to put it together virtually, but you're going to have your small business development council partners. You're going to have economic development partners, Chamber, CareerSource, all the partners. They're kind of a one-stop shop for employers when it comes time to start finding and putting that talent back into their places of business.
All right. This, of course, every segment that you and I have done, Russ, we try to provide a brief update. We have a special guest talking about a specific subject, and then we get into questions and hopefully answers for the community. Before we get to some of the questions that Avi has typed up there for us from the city's Facebook page, I'm also sharing it on my Facebook page, and I'm seeing a lot of comments and a lot of banter back and forth really about the big picture. And so there's a guy on here named Carlos saying, open up the city mayor. And so let's just address this big picture issue, and it's really important. So this is a public health crisis and at the same time an economic crisis, and we have to deal with both. And choosing one over the other, I'm going to say, is a false choice. We need both. They're interdependent, and one doesn't work without the other. But let's just get to the nitty-gritty of it, all right? If you have heard this statement from the vice president or anyone else that this is a federally supported, state-managed, locally executed response, what does that mean? That kind of gives the hierarchy of the response. So the feds provide support and funding. It's the state that manages the response to the crisis within the state, and then the local government really executes what's done at the state level. And with this crisis and emergency, it's different than a hurricane where Mr. Manager, you on behalf of the city would run our response. It's not the mayor. I'm the ceremonial head of our government and our form of government. You're the commander-in-chief. You're the incident commander. But in this case, unlike a hurricane, because it's really a public health threat, the county really runs point. And given the public health nature of it, especially because it's the county that has the Department of Health, St. Lucie County. Would you agree with those statements?
Absolutely, Mr. Mayor, and recognize as well that the health departments are really a state department as well. So there's in this hierarchy of a public health crisis and issue, the state and the governor is indeed setting the tone. The counties then, provide information. They make the public resource of the health department available to our entire county. The cities are then responding with the resources that we control, which is not the health department, but making sure that our water quality is good, making sure that we don't do things that would be contrary to that overall emergency declaration. And so, the comment is very, very telling for all of us. We all want to get back to work, but we have to get back to work in a smart way so we don't cause COVID-19 to start running, rampant in our communities again. So at the state level, the governor declared a better off at home order, executive order, that says for 30 days, we're going to take a time out for everything but non-essential, but for essential businesses only, they'll be able to operate. But for those businesses that were not essential, they will not be operating in our community. I think we see a time, coming up where we will see the non-essentials begin to come back in a phased manner. And we're seeing examples of where we can make, businesses and services work, in a way that is consistent with those CDC guidelines. For example, this weekend, the city was able to open up our boat ramps. We've been really focused on follow the CDC guidelines, but we're able to open the boat ramps. I think you'll see more and more services like that over the next few weeks, and more businesses begin to reopen, following those CDC guidelines. Some great ideas have come out of that, the idea that, wear a mask. That way you can reduce the potential for you to pass on whatever disease you might have, but certainly COVID-19. Keep a physical separation. Stay apart, 6 feet or more. And if you're sick, don't go to work. So those guidelines have really worked well for us. And I think you'll see those all incorporated into the fairly soon, return, back to opening up our communities.
Thank you, Russ. And so the critical takeaway there that I want to make sure Carlos Rangel and everyone out there in social media is paying attention to is that the city of Port St. Lucie at this point has not imposed any orders. We don't have a safer at home order. We don't have a curfew. We haven't limited freedoms in any way. We are responsible as a result of the governor's executive order to execute the governor's safer at home order, which was executive order, I want to say 20-91, as clarified in 20-92, where it said that it superseded all local orders, more or less. So that's kind of the state of play, the situation, if you will. And if we've been following along, we know that the president and our federal government has introduced a plan to open up America again, and those guidelines are available in many places, including my Facebook page. And those are guidelines. Because of our federal system, the reopening is actually up to the governors, and the governors will set forth the plans for reopening the states. And Governor DeSantis has said that a plan will be forthcoming this week. And I haven't watched the press conference today. Did anything happen today that I haven't?
They had their first meeting this afternoon. They're going to have 2 meetings tomorrow. So everybody tune in tomorrow. I think that's where they're going to.
And that's the working group that he put together, the task force. And over the weekend, he talked about that meeting so many times, but if they got a plan put together first, he would bring it. So they are working on it hard as they can, and we expect that to be unveiled this week. Mm-hmm. And what I think you can expect, members of Port St. Lucie and whoever may be watching this, is that the task force and ultimately the governor is going to set forth a plan that addresses the public health aspect and the economic aspect. And that our governor, like all the other governors, are going to try to right-size the reopening so that we can protect life and make sure that, and especially those who are at risk, do not fall victim to this disease and die, while also bringing our economy back line in a responsible way. And I just want to add my own 2 cents on that is, if you really look at different orders, the state of Florida was never closed down to the extent of other states. The governor put in place a different type of order that allowed more businesses to operate than some of the other states. But I imagine he's going to try to right-size that based on all the guidance. And when you look at this on the policy spectrum of we're going to lock it down to the maximum extent to save as many lives as possible, and we're not going to put anything in place and full throttle the economy. If that was the policy spectrum, he's going to try to right-size it and put prudent precautions into place. You know, something that we have promoted in Port St. Lucie, regardless if you're an essential service or you're engaged in essential activity. And Mr. Manager, when I was calling for a safer at home order before the county adopted one, before it was superseded by the governor, one of the things that I was personally for was that all business in Port St. Lucie is essential to our prosperity. Therefore, if you can comply with CDC guidance on social distancing, on screening, and on cleaning, if you can do those things, and simultaneously we can have the kind of testing we need to know if we're moving in the wrong direction or the right direction, and we can have that give and take, that's the way to manage the recovery and to move forward and to maximize service in the economy while protecting life. So that's kind of where we've been at, that's where I've been at, and I think that's where the governor's going to be at, big picture. But he, just like Russ is our commander-in-chief at this level, and Howard Tipton is the commander-in-chief at the county level, they, in the pecking order, have to follow what the governor of the state of Florida says. Is that right?
Yes, it is, Mr. Mayor.
So that's really where we're at. And so a lot of times when you're like, Mayor, do this, or Mayor, do that, I don't have that authority. And even our incident commander doesn't have that authority. And even, you know, the county administrator might not have that authority. We're really looking to the guidance of the governor on some of these big picture foundational response issues. Fair?
That is very fair, Mr. Mayor, and I do think that what we will see, and it just makes sense for everybody, is those CDC guidelines are going to be hand in hand with the reopening of our businesses and the services in our community. So we've seen the slowing of the number of hospitalizations. We've seen how that they really can work. Certainly, you know, it occurred with the stay-at-home order, or better safe-at-home order, but those are just good tools to use as we manage through this pandemic, and it really will help keep us safe. And so I would expect you'll see the governor very soon start laying out the plan at a state level, which will certainly then come to our county level and our city.
Thank you, Mr. Manager. And the one area where we really can act is where we're the owner. We're the owner of the facility. We're the owner of the building. And you saw that play out with the boat ramps, where the manager, in response to the initial, I don't want to call it bad behavior, but the initial incidents where our boat ramps were overflowing and people were not following social distancing, and the manager didn't think that he and the employees could manage the facility, we took a break, basically. We closed our 2 boat ramp parks, allowing an exception for commercial fishermen, and if there was a real hazard on the water, if like your bilge pump went out and you needed to get the boat out. But then after being able to process the response and seeing where we're at, and then manage the facility, you opened the city facility back up, recognizing that Martin County had reopened and that St. Lucie County had never closed. And I think you observed that we had a pretty good response, not totally perfect, but much better than the front side.
Absolutely, Mr. Mayor, and yes, people, I believe, were definitely following the social distancing. The launching of the boat is not the issue, it's how many people are on the boat. And so we did not notice any groups of or gatherings of over 10 on boats. There are now, Florida Fish and Wildlife does have an executive order that they're enforcing for recreational boaters with 10 or more. But we didn't see those kind of issues this weekend. A lot of people using our ramps, which is great. That's a service the city offers. And as long as we can continue to have our ramps used in a way that's responsible at following the CDC guidelines, I think we want to make those ramps available to our community.
Thank you, sir. And, as I just watch these additional comments come in, after we're through this emergency, there will be all kinds of opportunities to identify how we could have done a better job, how we will be better in the future, and that we'll prepare. But now is not really the time. Getting into partisan arguments, getting into pointing the finger, trying to play the blame game, it serves no constructive purpose. You should never fight with yourself as you're fighting a war against an enemy. So as Americans, we have to come together and focus on the battle in front of us, which is the response to COVID, and then simultaneously finding a way forward and opening up as much as possible without killing our friends and neighbors, and especially those at risk, our seniors and our immunocompromised. So we're not choosing one over the other. We're going to find the best way forward on both. And it's not easy, and we won't be perfect, but we all have to come together and focus on that. So we'll hit some questions. And let's see here. That's more of a comment. Let me ask you, gentlemen, are you aware of any resources for helping people with intellectual and developmental disabilities? And I'll assume that's finding employment.
Well, I can say from our perspective at Career Source Research Coast, that is one of our target populations that we help. Our comprehensive career center is the St. Lucie County Center out in St. Lucie West across from the Met Stadium. And we have a wonderful partnership with Voc Rehab, Blind Services, all those partners that are mandated through the law that our funding comes down through. So yes, we can help with those disabilities. We help all types of folks with disabilities. We even offer a Ticket to Work program for those with disabilities that are receiving Social Security disability benefits, and they want to get back into the workforce. That's a wonderful program that we have available to our residents, especially those with disabilities that are receiving that type of benefit. So again, please go to the website, check it out, ask a question through the chat, and we'd be happy to help. I think I could take the next one too there from Beth M.
Yes, and actually, so on that one, again, hit me. I always like to repeat the numbers so people know who to call. And because right now you're virtual, the whole office is virtual.
Yes.
What's the number again for them to call?
Our toll-free number is 866, the number 4, the letter U, 2 higher, or that's 866-482-4473.
Excellent. Carry on, sir.
Next one, I believe, is from Beth M. I can quickly hopefully I can provide you some insight and guidance on that one. You are, as many are, struggling with filing your reemployment claim. I'm not sure where it is in the pipeline. You're more than welcome to try to reach out to our folks, my team at Career Source Research Coast, who have access to the Connect system. If they're able to get into the Connect system, they can check and see if you had a claim that is in the system and where it might be. But my other thing is, I know that you're at a crisis point. I would recommend strongly that you go ahead and fill out another application. As I mentioned earlier, there might be duplicative applications in the system. It can't hurt for you to put in another application, Beth. So you can go, of course, to floridajobs.org. That's the DEO site where you can file an application online. It is mobile friendly, or you can always stop by our career centers, especially the one in St. Lucie West, and get a application, which we have on our doors outside, on the buildings outside of our doors.
Thank you, sir. Thank you for hitting both of those. We had a question regarding hairstylist, hair salon type uses. And again, we're just as much as you are kind of waiting with bated breath on the governor's order. And we would just be speculating, like, for example, since he has advised the locals that they can open up beaches, I wouldn't be surprised to say that he's going to reopen state parks. I wouldn't be surprised that if he said, you know what, we're doing pretty well on hospital beds, so we're going to go ahead and allow elective surgery for as long as we maintain this cushion. I wouldn't be surprised to see that and all sorts of other things. But where he'll be at on those specific uses, I couldn't tell you, because we are waiting for the details of that order in much the same way that we waited for the Safer at Home order, right? And we had to wait for it. We had to read it. We had to read it multiple times. We read it together. We read it with the attorney. We asked ourselves questions about it again. We didn't get any preview to it. We didn't get an advanced copy of it. We got it when you did. And it's the same thing here. Is that fair, Mr. Manager?
That is, Mr. Mayor. I think again, what we'll see, I suspect, will be the businesses that are essential, that can easily work within the CDC guidelines will be probably the first phase. And then as you look at other businesses, other activities and services, the better that they can comply with the CD guidelines, you'll see those businesses reopen as well. A hairstyling salon is, you're very close to each other. It may be that if you're working with the CDC guidelines, that might be, how can you work within those parameters? And then the last, most likely, will be things like the Dolphins games, where there's 100,000 people that come together all in a big stadium, and it's impossible almost to follow those CDC guidelines. So I think in the president's discussion, he identified these three major phases, and we haven't seen what the governor will come up with yet, but it wouldn't be at all surprising to see the bookends, the easy things to comply with, the beaches, you can stay apart. You can stay 6 feet apart. The Dolphins game, a little harder.
You have anything to add, Brian, on that? Do you have any insight into the governor's thinking?
I would just say to tag along with what the city manager said, is that, as things start to open up or reopen again, please continue to practice the social distancing. I know, again, I'll use the paper application as an example. The minute we put them out there, everybody, rightfully so, everybody's in need of that. But again, we got hordes of people, and we can't have that. We really need to continue to focus on social distancing, making sure that we're protecting ourselves and our neighbors and our families and our elderly as we begin the reopening process. So that's just take caution, think a little bit, be thoughtful when you react.
Thank you. And we have a question about, or a comment regarding a certain strain of coronavirus or another disease that could potentially be worse, perhaps a mutation. And what I would share is that at our level, at our city level, we are trying to execute the national and state guidance that we're all receiving, right? Because we're kind of where the people meet the government, but we're not setting that. And then furthermore, let's take this as an opportunity to talk about testing in general, because you've heard a lot about testing, as you should, because in a response to a pandemic where there's no vaccine, there's no proven antivirals, you only have two tools in the shed. You have testing, where you isolate and trace if it's a confirmed case, and then you have social distancing. I mean, those are the two tools. You've heard a lot of talk about testing. Every level of government is working on testing, but the whole world is working on testing. So there is a national and international shortage of test kits. You've heard about there being shortages of reagents, of swabs. Every little piece of this, there's been a shortage, because the whole world and the whole nation and every state is wanting the same thing at the same time, because everyone has the same need. And so because there are limited supplies, the government at the national and state level is forced to essentially ration and direct the supplies to where they believe they're needed most. And so nationally, that means places like New York, that's been the hottest of the hot spots in our country, and in places like Florida, Southeast Florida, Miami-Dade, Broward, and still playing catch-up is Palm Beach County. So that's how that's worked out. I am quite certain, I'd at least be willing to bet on it, that the governor's plan, his reopening plan, is going to include a testing element. It's going to address testing, what the expectations are moving forward. Maybe we'll even, it would be great if it was specific and talked about how it was going to ramp up and get from where we are now to where we need to go. But at the city level, we don't really have the ability to impact that in a meaningful way. I think we'll have some ongoing conversations about how we can address first responders and make sure that we can continue to provide services. Because, for example, we had 5 police officers come in contact with a COVID positive person as part of a call for service in the police department. And then those officers have to be isolated, and heaven forbid they be confirmed cases, and then you got to contact trace, and then you're losing part of your workforce. And so we've seen that happen across the country, where you lose a big portion of your first responders either to the disease itself or to the concern that they've been exposed. So I could see the potential, Mr. Manager, for us as an employer doing some testing on our first responders. Have you worked on, or have you looked into that?
Well, yes, Mr. Mayor, the city, as you're seeing in the community, have had difficulty getting access to testing. As a few more tests to become available in St. Lucie County and in the state, we are able to get tests if we do have an exposure. And we're working particularly for those public safety employees. We will get folks tested. We don't have access to the rapid test, which I think will be a game changer for many of the communities in the nation. But we are making it a priority. If we have a potential exposure, we do everything we can to get those employees tested, because we need our folks working and helping out in delivering services. So we are seeing a few more tests. Now we could get a city employee, a police officer tested, where just a couple of weeks ago it was very difficult. So I think there is a little bit of movement, but not the amount of movement that we really need on testing to be able to say anybody who feels like they may have all the symptoms of COVID-19 can get a test right away.
And thank you. And certainly, even if we were able and are able to get tests for the first responders, that doesn't help that frustrated citizen at home who has been symptomatic and can't get a test because they have to answer 1 or 2 additional criteria off the list of 3 or 4 criteria. But to your point, as the ability of the testing wherewithal has grown over time, we have seen the criteria move in the right direction. But I really appreciated Senator Scott's quote on this. He basically said to the effect that, any American who's symptomatic should be able to get a test, period. And I also believe in that standard. I think that's where we need to get to, is that if you're symptomatic, that you can get a test, an inexpensive, reliable, fast test without having to go through the rigmarole. And certainly if we want to reopen society, it feels like that has to be a part of it. And the thing about this disease is that I might get tested today and be negative, but that doesn't mean I'm going to be negative in 5 days. And so, even one test for everyone isn't really enough when you're talking about overtime and keeping your employee populations safe. And all employers are thinking about this. Big companies, little companies are thinking about this, not just on the public health side, but as an employer. What's my responsibility to create a safe working environment for our employees? So, Brian, I know you've been reading this next question. It's a short, it's a long story there, and you're continuing to see the frustration of people because, again, those claims, what was it, 41,000 or so? That's all that have been paid so far?
Yes.
So it's only going to get worse over time because the frustration is understandably just going to grow. What's that number where they could reach their career source backdoor?
Yeah, they could go to our website, careersourcerc.com, and we have an instant chat that you can get a hold of somebody, at least talk to somebody like this individual here to talk about the questions that they've encountered. We might not be able to help you locally, but we might be able to assist getting to the department, at least trying from our side to see what we can do to help rectify the situation. Again, we're in unprecedented times when it comes to unemployment, even from the federal level. We've never really had we've had, you're talking about self-employed people now that are lost their jobs because they can't work. And you have certain requirements or criteria in current state statute with regards to requirements for receiving unemployment. And these things have not been addressed. And Mayor mentioned it earlier, is it's going to take time for us to, right now we're in recovery, then we're going to have to get into, we're responding, then we're going to be in recovery, and then we're going to be reimagining. And part of that reimagining is talking about these things that we come up with along the way. So again, please reach out to go to our website. We'll do the best we can. There's also some information on there about the CARES Act and how that might apply to you at the federal level. There's a Q&A, FAQs available. DEO, the department, has also recently just provided a at-length FAQ response that you can link to from our website, or you can go directly to their website. May be able to find some of that information that was in that particular question about somebody who is self-employed and what they can do to try to get their reemployment claim processed.
Thank you, sir. And I would encourage, so Avi's typed in some really case studies, some stories, personal stories, where we have citizens sharing some of the details of their case in the hopes of getting help. I would encourage you to email me at mayor@cityofpsl.com with all the pertinent case info. No social security numbers or anything like that, but your contact information, the same things that you're sharing here, to mayor@cityofpsl.com with a copy to B. Dolan at cityofpsl.com. And Brian, when we're done here, let's put our heads together and you kind of give me the lay of the land on the key facts. And then in addition, because it's no substitute for contacting the back door, so to speak, at CareerSource or the DEO. I mean, really, I want you to follow this resource guide right here on COVID-19, and it's long, it's 38 pages. That's the real way, but then in addition to that, try the backdoor CareerSource and email me at mayor@cityofpsl.com, and we'll put together kind of a local spreadsheet on the local cases, and maybe we could work towards making sure our citizens get service. Does that sound like it's something you'd be willing to do?
Most definitely, Mayor. And again, I encourage folks to go visit the website, use the chat. That helps us build the database that the Mayor, we can then put together some sort of spreadsheet to talk about what we're finding in our local communities with regards to status of claims and, frustrations. And because if the more we gather, the more we can send up to the state to say, okay, here's what's really going on at the local level. So happy to help.
Thank you. Really appreciate it. So we have a question, and I've seen this one come up again and again, and it's about people being back on the streets and people not wearing masks and gloves. And I want to make sure that I take the right amount of time and approach this the right way so that you know that I care, and I'm not trying to be rude or too curt, but we're trying to find balance here. And we're talking about the reopening of society, and we're talking about living under a safer at home order that lets people out of their house for all kinds of reasons, essential services and essential activities. So being on the street in your car, you may very well have reason to be out under the safer at home order. And then furthermore, even if you don't have a great reason to be out, if you're in your car, you're really isolated, so you're not presenting that public health threat. So we got to try to be understanding, and we have to try to understand that this has been going on now for a while. Some form of it's going to continue. It's not just going to end tomorrow when the governor unveils his reopening plan. So we need to help people comply over time, understanding that you can go stir crazy, you can get cabin fever, people need to be able to leave. What we're asking people to do is to behave responsibly no matter where they're at. If they are in essential activity, if they're engaged in essential activity, if they're in essential service, or if they just had to get out of the house for something non-essential, we want them to follow the distancing, the cleaning and screening. If you're sick, you have to stay home. And what I would say is that there's always an opportunity for personal responsibility, personal accountability, and self-determination with this. So no matter what the government does or doesn't do, no matter what the behavior of others might be, we always have the option of doing what we should do to protect ourselves and our family. And what do I mean by that? I mean, in my case, my wife is immunocompromised. And so she's going to stay home, and she's able to stay home. She's able to telecommute for work and work from home. And so when the kids, I have 3 children, when we have to go out, when we must go out, or we choose to go out for an essential service or an essential activity, then we take extra precautions on hygiene. Not in a room like this because there's only 4 people in a very large space, so we're not all wearing masks. But when I go to the grocery store, when I go to Sam's, I do wear a mask. So we do that. We use wipes, we clean the car, we strip in the laundry room, we take our shoes off at the door, we go right to the shower so that we can protect our loved one, my wife and their mom. So that's what we're going to do, and that's what I'd ask you to do. And when it comes to gloves, it's just a pet peeve of mine because really no one follows good glove protocol. So most likely what you're doing with gloves is you're smearing the germs all over the place and having a false sense of security. So with the gloves, and then a lot of people are just chucking them into the parking lot when they're done to boot, which then forces the property owner, the store owner, or the city to go there and pick up dirty gloves. And so with that, I would just ask people of Port St. Lucie to just engage in good hand washing. And that's really the proven technique. The mask, obviously, there is a benefit to face coverings. And it would be great if everyone could wear an N95 respirator, but there's not enough for our healthcare professionals, let alone our first responders. So it's going to be a while before that guidance would change. But face coverings, we are following CDC guidance, and we are encouraging people to use them. Mr. Manager, when someone asks you, why don't you require it, what do you say?
Well, there are 2 issues. One, there's not a uniform availability of the mask, and that's a big issue. What has been the position of the governor's office, and even at the federal level, strongly encouraging wearing a face covering, and that's what we do as a city. We strongly encourage our residents to use a face covering. A mask is preferable, but if you don't have a mask, use a bandana. And you're protecting other people around you. You're protecting your loved ones, your friends, your coworkers by wearing some kind of a face covering. Over time, I think we'll see more masks available that are really more effective in keeping you from perhaps getting a disease. But right now, you can wear a face covering and help those around you. Even if you have just a standard old cold, the mask helps you. And I've got one right here that I've been wearing, and I wear it whenever I'm out in a public place, not at this dais because we're about 10 feet apart. But if I'm going to be close and I'm in a public place, and I know, Mayor, I've seen you, with your mask, and we'll continue to do that for a while until we get some all clear notices.
Well, why don't you just write an order? Why don't you just write an order right now and require it? What's the reason for that?
We would typically write orders we can enforce, and we really can't enforce that mask. We can strongly encourage it.
And to your point, even I've read some of the orders because I am supportive of orders like Palm Beach County. I didn't see where they're actually enforceable. It's really just it's messaging. And so we are messaging, we want you to wear a mask and take every precaution, especially if you're going to be in a place where you can't maintain social distancing. And this could, again, be part of the governor's reopening plan as part of prudent precautions and trying to allow the economy to function. We are going to impose those additional safeguards. So let's see if that's part of the plan. And of course, this is always evolving. But I appreciate you answering the question because I get it all the time. All right, city park employees are still working, maintaining the parks. Active dogs can't ride bikes. Well, it's always a neat trick when dogs can ride bikes. Why can't dog parks be open at this time? You know, Mr. Manager, I don't know if you want to hit that, but you've tried to maintain as many park facilities as you can for passive recreation, but we can't allow gatherings. And actually, if you would look at the CDC, it's the same guidance for our pets, because there is some question, and we've seen where dogs have tested positive and tigers have tested positive at least. I don't know what other creatures have, but I know that dogs and tigers have. And the CDC guidance for your dog is basically to do what you do, and that is treat it as a family member. And so just as one of 5 people that the manager works for, I'm only one of 5. I only have 1 vote. But I would not support social gathering at dog parks in the same way that I don't support social gatherings for people at this point, based on all the best guidance available. I don't know if you have a different take.
So what I do know, Mr. Mayor, of all the requests that we've had to reopen various services, dog parks is number 1. People really enjoy dog parks, and dogs enjoy them. But what we've found, our dog parks are not managed by our employees, and so we can't prohibit the gatherings that were occurring. And indeed, it's not unusual at all in a dog park to have 10 humans or more and 10 pets or more. And so until we can find out a way that we all feel a little bit safer, we've been reticent to consider opening our dog parks. But it is on the top of the list of one of the first things we want to reopen, because it is such a great part of our life as a community. And so we'll continue to review it. It really would require staffing each dog park on a multiple hour a day process that's just very difficult for us as a city to accomplish at this point.
Thank you, Mr. Manager. And many of our parks remain open for passive recreation, but there's really very few sports that you can play and not engage in mixing and social gathering. So all of the active facilities remain closed. There are places, though, that you can walk your dog in several of our passive recreation areas. So there's definitely places that you can go, engage in essential activities, and do it the right way, the safe way. We are always in contact with our friends and colleagues at St. Lucie County and the St. Lucie County Commission. I do expect that they will address beaches this week. That's my personal expectation. But I just checked the website. I didn't see any update. Have you heard any update on that yet, Mr. Manager?
No, Mr. Mayor.
So I do think it's going to happen this week, based on some of the conversations I've had. But we have to wait and see. But I would expect it to happen this week. We had a citizen ask about showing no symptoms, being asymptomatic, maybe being recovered, not being able to get a test. And so that goes back to that testing issue. And so really I was talking about diagnostic tests at that time. And that's really where, you have symptoms or you think you may have and you want to get tested to be diagnosed, a diagnosis. There are also additional kinds of tests that you might hear about, and the governor's been talking about at his press conferences. It's the blood test, the antibody test, and also surveillance testing. So in addition to testing symptomatic people or people that have been exposed, you have surveillance testing where they do a random sample to see what's happening in the background and that helps to capture the asymptomatic or the pre-symptomatic people. And then, of course, you have the antibody testing that everyone is talking about, that if you can get the right test so you don't get this wrong, then you can see if people have the antibodies that coincide with, hopefully, immunity to the disease. But if we can't get the testing on the diagnostic testing right, we're not there yet on the antibody or the surveillance testing. These are all works in progress, and we look to our governor as the incident commander of the state to help us set expectations, help us understand where we are now, where we want to go, and how we're going to get there. All right, so we've put in a good effort. I want to thank you, Mr. Manager, and our employees for continuing to work hard. Brian Bauer, thank you so much for all your hard work and agreeing to be here and taking on those DEO and those tough reemployment questions. Do you have any closing statements that you want to make?
Mr. Mayor, we want to thank everybody who does wear a mask. We want to thank everybody who follows the CDC guidelines. There really should be requirements, because that's what it's going to take for us to really make a difference in flattening the curve, making sure we don't have excessive COVID-19 in our community. As your city manager, you can feel assured that your city services are going to continue, whether it's our police department, our water, our sewer, all our solid waste will be picked up. But it takes all of us pulling together. And the parks are going to reopen, and you'll have dog parks too. But it'll be, maybe a couple of weeks before that happens. But we're committed just as soon as we can to get our city services back open 100%.
Thank you, sir. Ryan?
Again, I just want to say thank you for the opportunity to be here today with you all. It's a pleasure to have the chance to get in front of some folks to talk a little bit about what's going on here in our community, what Career Source Research Coast can offer you now, as well as we get into, I mentioned earlier, that recovery phase when it's time for us to ramp up and reopen and get our talent pipeline back into our employers. And in closing, I did want to mention this, and please don't take any offense to the employer, but Piper Aircraft is hiring apprentices, and they're having a webinar tomorrow at 6 p.m. On their apprenticeship program. So they're looking at another phase of apprentices to come to work. So here's another example of employer that is hiring at this time. So if you're interested in that, please check out our website, or you can always go to the Piper website as well. So again, just another example of there are employers and there are positions available to those in those sectors. So again, thank you very much for the time and opportunity.
Thank you, Brian. Thanks for being here.